Okay, one more time. I just popped the audio up a little bit. Can I have your first last name spelled?
Yep, Robyn Schertz, ROBYNSCHERTZ.
And what is your official title?
The Assistant Senior Physician Executive, Aspirus Medical Group North.
What is happening with COVID-19 vaccines for kids ages 5 to 11?
The newest update about COVID vaccines for kids ages 5 through 11 is that the CDC and the FDA have now approved the vaccine for emergency use in that age range.
So how do we know that this vaccine is safe for kids?
Well, they've been using it in studies and have had no adverse reactions within 5,000 plus children who have received the vaccine. And we also have data to prove it's been safe in other age ranges as well.
What are the differences between the vaccine that's being used for adults and this one that's for kids?
The kids will receive a smaller dose than the adults. The dose for children is about a third of the dose that the adults are receiving.
What should I do, or why should I, if I have kids, why should I get my kids vaccinated?
It's important to vaccinate kids because although their risk is lower than that of the adults, kids are still getting sick and are still dying from COVID-19. So it's important to have that option to keep your children safe. So vaccines in general are one of the most important tools that we have in our arsenal to keep kids healthy and out of hospitals. And the COVID vaccine is yet another resource for us to make sure your children are protected.
Okay, so why should somebody get their child vaccinated?
So in addition to protecting your kids against the virus itself, it's important from a population health standpoint. We know that COVID actually produces long-term health effects in many people, especially in adults and elderly. And so the better that we can prevent community spread through vaccination and some of the other social distancing techniques we've been using for the last couple of years, the more we can prevent the spread and keep individuals healthy